and then firmitus. And then percussion, the heart borders, the relative dullness or absolute dullness border. I will teach you how to check um, heart border dullness, but the question is that why we have to check the heart borders? Who can answer me this question?
There is many disease like megalia hurt and some natural stenosis or tricuspid stenosis. So we can check the heart borders.
Okay, good. And anyone else? So, okay. Okay, so the guys, his answer is very good. Overall, he was like, is like this. We check the heart borders, for example, to see the size of the heart is increased or decreased or something like that. So that's why we check the heart border, and this thing can give us information about some diseases, right? So, for example, so let's say one example is cardiomegaly, and other things we'll detail discuss in future lectures. And auscultation of the heart is one of the very important thing. You have to check the heart rate, rhythm of the heart, heart sounds, murmurs are the abnormal sounds from the heart. So this all abnormalities of S1, S2, splitting of S1, S2, S2, systolic clicks, diastolic opening, snap, vocal firmitus, premature beats. These are really complicated kind of terms and they have a lot of explanations. So here we will not explain, but I'm giving you the overall. Yesterday someone asked me that if I can get a PPT in advance. So I told him that I have already given you the base guide and PPT till last time we prepare, like now I am giving the lecture till the beginning of the lecture. We modify, we add things, remove things, so it's little inconvenient for us to share it before. But anyhow, these all terms is your homeworks, and it will be very good that if all of you become responsible and finish this thing, get a little bit idea so that we can discuss on them very very detailed, uh, and understand them quickly. Okay, so the next examination, inspection, abdomen. Abdomen we already like that day discussed a little bit. So what you see in the abdomen is the symmetry of the abdomen, size of the abdomen, abdominal distension, pitting like concave mirror, right? So it's like this kind of abdomen. Respiratory movements you can also see from them. Skin lesion, pigmentation, surgical scars on the abdomen, umbilicus like hernias, body hairs, venous distension, and direction of blood flow, peristaltic waves. So this all things you have to write in the history record in the abdominal area. Palpation, the tenderness of the abdominal wall, rebound tenderness, mass, and then location, size, shape, tenderness, mobility. So this all is the aim to check in the palpation of abdomen. And also in the abdomen, you have to write in the medical record is the liver size, characteristic, surface edge, tenderness. In the gallbladder, you also have to write size, but you cannot write size until you have the, you know, ultrasound or any other examination available. So if in this physical examination, if you have these investigation available, you have to mention that, like the gallbladder was this much size, swollen, not swollen, what was the shape of this thing, and it was tender or not tender. Spleen, again you have to go for size, character, tenderness, surface edge, this all. And the kidney, you have to see the size, shape, character, tenderness, mobility, this all for the kidney. And bladder, distension, and costovertebral angle tenderness for some disease. So this all is for the abdomen. And in percussion of the abdomen, you have to write the liver dullness border, hepatic tenderness, and shifting dullness. And auscultation, you have to see the bowel sound and vascular bruits. Physical examination of the spine, you have to tenderness of the spine, abnormal spine, extension of the spine, rotation of the spine, lateral deviation of the spine, so you can exclude some diseases from the spine area. And extremities, you have to see the deformity, veins, distended veins, stiffness of your extremities, and then limitation of the motion, joints, and then strength. This all information should be recorded in a physical examination. And in the nervous examination, you have to write the bicep tendon reflex, tricep tendon reflex, patellar tendon reflex, Achilles tendon reflex, and then abdominal superficial reflex. And some signs you should be familiar is the Babinski sign, Chedok sign, and Hoffman sign, and then Brudzinski sign. These all signs in the nervous system. Please review them, okay, in future lecture. This all I will show you and how to do these things in detail. Laboratory and other special exam laboratory tests should be mentioned on your history page, like all the data that are associated with diagnosis, including 3 routine tests and other lab tests 24 hours after admission, and some special exams like gastroscopy, X-ray, etc. So the summary will be what? Combining with the case history, physical examination, lab data, and propose the evidence of diagnosis, and finally set up the diagnosis. So this will be summary of your medical record. Okay, so after that you will make the primary diagnosis, because maybe still your diagnosis is not like accurate, it need more workup. So this, because of this, we write the primary diagnosis, and then you will write the signature and stamp. So this is our whole process of writing a medical record. You, like for example, here I give you one example. If the patient is there with abdominal pain, so in the medical record you have to go through the whole systems, not only the abdomen. You have to write all these things that already you have seen in the PPT. These all things is our aim of this diagnostic subject, that in the end of our this subject we should be familiar with each and everything that we have or had already discussed in this PPT. So this is our aim. Record of the course of the disease. Okay, what is this thing? The record the progression and treatment of patient disease since admission. So this is another thing. Okay, that was the history. It should be recorded truly, promptly. It actually reflects the quality of the medical treatment. It can be written once a day according to the changes of the disease. For those severe cases, it should be written several times per day. For those patients with mild illness, however, it could be written every 3 days. So this is another record. Like, let me go back to the beginning. Um, let's see here. You see, now we have already finished this case record. How to case record, and then record of course of the disease. Okay, now we are on this topic. Okay, so record of course of the disease is the progress that you have to be writing on the separate page, so that the physician, for example the consultant, he comes and he quickly will see that thing. record of, because first day the physician will see the whole history. From the second day, or maybe the first day, second session, the physician will only see the record of the course of the disease, that how our disease is progressing. Is our patient getting better, not getting better, which medication given? So this all thing is record of course of the disease. Common medical documents that you should be familiar is record of admission, record of course of the disease, record of consultation, record for transferring to new department, record of discharge, record of death, and others. So these are the common medical documents a medical student should be familiar. That tomorrow if someone asks you, okay, bring me the record of death, so you are just, okay, I don't know what is the record of death. So these things should be familiar to a doctor. So content of the record: the patient complains about his/her discomfort, mood, physiological status, food, sleep. Those can be further selected according to the need for progression of the disease. The changes of the disease, including signs and symptoms or any new discovery, the results of various lab or other exam, the analysis, evaluations, or remarks on those data. So these are the things, like the contents of the record, what you have to be writing, like is discomfort, mood, is state, is disease condition, signs and symptom, or any something new symptom appear, various lab records, like you should be writing, okay, today, for example, let me give you an example, that you have admitted a patient, he is suffering from diabetes. So if he is suffering from diabetes, you are checking his first day he came and you checked his glucose level, for example, let's say it's 200 mg per dl, and then if you not check it again and not write it in the record, next time how the physician will know that after the therapy or after the drugs his blood sugar level is reduced or not reduced, or it is the same or not same, right? So this record is important so that we can, like improve our therapy, and we know that what the patient responding or not responding to our therapy. Records of various manipulations such as pleural punctures, abdominal puncture, endoscopy, cardiac catheter exam, and various radiographs. This you will be also recording time to time, like in the first initial session maybe you have not ordered these examinations, but later you order, and reinforce or amend the clinical diagnosis, amend the evidence for the diagnosis. For example, you have made an initial diagnosis, now it was not true, so you amend and change the diagnosis. And then the opinions of some senior doctors should also be on the record about the diagnosis, differential diagnosis, and the treatment, so that you can make a new plan for this all things. Okay. Opinion of consultant of other department. So this opinion of consultant of other department should also be noted on the medical record. Information from the parents, patient's relatives, their hope, desire, and reflection. Monthly brief face summary, time of record, and signature. So this is not important. Record of consultant is what? In journal, the consultant opinion will be written in consultant sheet. There will be a different sheet for the consultant. You have to write, for example, your department, a patient is there and you suspect that he is also suffering from the cardiac disease, and you refer the patient to the consultant of other department. So there will be a sheet there that is called consultant sheet. He should not be saying the things with the mouth just orally. He should have to write it in a sheet, right? The consultant opinion include brief description of case report, specialized exam, the analysis and diagnosis of disease. Purpose his opinion for further more precise exams and treatment. So why we send the patient to other department or consultant? Our aim is that we can have further, like, opinions and improvements in our diagnosis. Record for transferring to new department. It can be written in record of course of the disease sheet. The content may include the major cause of the disease, treatment, the reason of transfer, and precaution notes. So this is very important, that when you admitted some patient and later you realize that this patient does not belong to your department. So this time you have to write the reason for it and the treatment and this all the course of the disease, so that other department should be knowing that what you have done and why you have transferred this patient to other department. If the patient is transferred from other department, resident should write the record of transfer. The content of record is similar to record of admission. Simple. Record of discharge. This you will be doing a lot. As a medical student, this will be, or you will be doing the house job. This will be your primary duty, that you should be writing the record of discharge. Very, very important. What you have to write in this? You have to write first is name, there is gender, age, diagnosis of admission, date of admission, diagnosis on discharge, date of discharge, and days of hospitalization. Various number of special exam, for example, number of hospitalization, number of X-ray, CT, pathology, ECG, etc. So this is should be there. You will not give the history record to the patient. That will be in the hospital. What you will be giving to the patient is the record of discharge, and this all things you have to write. And then other contents, what you have to write is briefly introduce the reason of admission, present illness, the data or date of major exam, the progression and treatment of the disease during hospitalization. So as a medical profession, you have to write this all data, because this patient, for example, is discharged. The next time he goes to other hospital, he will take this record of discharge. And if you have not written it professionally nicely, then it will be a big shame for you and your hospital. So this should be very precise. The aim again is that the other hospitals, when see this record, they should know clearly what happened to the patient before, and then they make the planning and treatment of the patient in a nice and easy way. The condition of the patient on discharge, including sign and symptom, results of major exams and treatment, and recover, improve, not affect, worsen, complication, and treatment advice on discharge, not note for precaution. Like for example, if you give this thing to the patient, he take it to the other hospital, and then the doctor of the other hospital, when he will read the record of discharge, he will know that what examination, what happened, what was these things. For example, the patient, these examination record, he lost it, but he has the record of discharge. It will save lot of time, lot of money, and lot of effort, right? So that's why this thing is really, really important. And then your advice on discharge is very, very important, that, like, for example, these drugs, you have to use it for 1 week, 2 weeks, and precautions, for example, you a patient with broken bone, you have to not mobilize the bone, you have to not, like, doing the hard work, you have to not eating spicy food, you have to not doing this thing. This is very, very important, this advice and note for precaution, because if you have not written the note of precaution, he went back, he did some, like, things that can harm, that harmed him, later he will be start blaming you all the life, and then also by the law you will also be blamed. So this thing is very important. As a doctor, you have to save yourself for all this kind of things. Record of death is also very important thing, very very important. And I tell you one thing, this thing I will include in exam. So all of you note this thing. This thing I will maybe give you a question or anything, that how to write the record of discharge of patient. Okay. Record of death. The content and format of the death record are similar to that of discharge. It includes case summary, hospitalization, diagnosis and treatment, the cause for disease progression, the rescue course, time of death, cause of death, and final diagnosis. So in many medical universities, they don't teach this thing. What happens that when you go to the hospital, you get a lot of problems there, and then your image will be not good, because as an intern, when you enter, if you know this thing clearly, for one whole year of your house job, you will be writing the record of discharge, record of death, and history, proper history from top to bottom, including its all these contents. So I hope that when I finish this subject, all of you will be well prepared for house job or internship, and then it will be very easy. And then once you prepared for this very well, you entered any hospital, within seconds or minutes after the doctor asks you first, can you write the history? Can you write the medical record? Can you write the record of death? If you can tell him that I know how to write, he will be very, very sure quickly that you are one of the best students. For all death patients, particularly those cases of diagnosis are uncertain, one should persuade the relative of the death patient to perform the autopsy. The anatomical pathological results will also be recorded. So that's why the autopsy is done. For what reason? Is for reason is that if we are not sure what is the cause of the death, so we do this pathological autopsy and find the pathological results and write and record. That can also be used for research and future purposes or medical legal purposes also. Others is going to finish soon. The routine medical documents also include summary of pre-operation, record of post-operation, record of surgery, etc. Other format is consistent with record of course of disease, and summary of pre-operation may emphasize to record the disease condition, reasons of operation, types of operation, the possible complication situation occurred post-operation, and method towards to these complications. Post-operation record should record the condition of surgery, finding during the surgery is very important. Now, what you have found during the surgery, name of the surgery is very important, disease progression during surgery, type of anesthesia, type, response of anesthesia, treatment advice for post-operation. This thing will be very useful when you will be rotating in surgical department. And the record of surgery should be written by surgeon who performed the surgery. When you will be in the operation room, after surgery is finished, you will have to write this all surgical record. So this record is very, very important. Okay. And outpatient record is little different. Cases record of outpatient. Now we just talked whole time. It was the inpatient record. Now we will know how to write the outpatient. Do you want to take a break for 5 minutes?
No, sir.
No? Okay, let's finish this. Okay, don't write on the screen. It's just, I don't know who do this. Okay.
Break.
The diagnosis can be made after the patient first visit. The diagnosis can't be made. Okay. The patient can be treated as symptom, cause unknown, such as abdominal pain, cause unknown, fever of unknown origin, In addition, one or more suspected diagnosis can also be made. Okay, for this is for the outpatient. It's not admitted in the hospital. You just seeing in the outpatient department. So you cannot write the diagnosis, but you can write the suspected diagnosis. Okay. The next thing is I don't know why it's stuck. Let me see. Okay. The Department of Emergency, the record should include the precise time of consultation. Very, very important. When you are in the emergency, you should be writing the precise time. Apart from the present history of illness and most important sign, the vital sign, consciousness, treatment. If the treatment failed, the patient died, time of death, diagnosis and cause of death should also be included, and signature of physician, handwriting or stamp. Dear students, I don't know whether you are taking this lecture as a serious lecture or as a good lecture or not, or maybe you feeling for maybe boring or something. But I tell you, this thing is like, I cannot tell you how important it is for your future. This today's lecture, no one will teach you, no one. So because I been suffer from this thing, so that's why I'm teaching you this thing. Please revise it and save it and study it again and again. These are really, really important things for your career. And the cover should be filled with patient name, age, case record of outpatient, content. Number of important exams you have to write on the side, day of service, chief complaint, history of illness, present, associated past history, personal or family history. You have to write in the outpatient. You don't have time to write that much. You just have to write simple clues, okay, on that page. Like, the doctor that you give you the page that all the time you go to the doctor, you see the doctor and then he give you some, prescription page. We are now talking about that. And physical examination, on the side you have to write the positive sign and important negative sign. This just simple write these things. You don't need to, in the outpatient. Actually we need to, but we don't have time, so we just write these things simply. What examination we have done? First, the patient name is very important, address and this all things. And after that, which date you have given, what was the chief complaint, simple present history, and then positive signs, right? So that's will be an simple suspected diagnosis. Lab exam, primary diagnosis, and then after that you have to write the further exams, drugs, times and advice, and then signature, and that's it. That's finished for the outpatient. So this PPT is over. Now you can ask questions. All of you are welcome to ask questions.
No questions.
Clear? All of you?
Yes.
Okay.
Yes.
So for exams, I tell you one thing for exam, okay? Record of death, record of discharge, and how to write the case, this one, how to write the case record of outpatient content. This one from here, this page and this page, this two page. This is important for your exam, okay? Any questions now?
Sir,
Yes.
does the inpatient mean the patient who is admitted in the hospital, like for days?
Yes. Is anyone who is admitted in the hospital, and outpatient mean not admitted. Just you have seen the patient outside means in the hospital and he go back home. Outside the ward, he should not be in the ward. Okay, any other question?
Okay, sir.
So do you want me to continue with other PPT or this enough for today?
Enough, sir.
Because problem is that we